Hi, it's Tessa with Hip Over 50. So I've been a little MIA from the channel lately, but that's because I've had a minor surgery done and it affected my right hand. If you have hands, you may want to pay attention and listen up and see if this might apply to you. What I had done is called Ulnar Nerve Release surgery or Cubital Tunnel surgery. About a year or so ago, I finally went in for some tests because I was experiencing a lot of pain and numbness in my pinky finger and my ring finger on my right hand. And I thought it was just, I thought it was just arthritis or I didn't know what it was, but it had been going on for quite some time. I finally had something called a nerve conduction test where it can vary. It all depends on you. My symptoms are, numb feelings in this finger and this, mostly in my little pinky finger, pain in my pinky finger. I have two main nerves that kind of affect our fingers. One, the ulnar nerve goes from our shoulder all the way through our elbow into our hands, and it affects these last two fingers, the pinky finger and the ring finger. Carpal tunnel or medial nerve surgery also goes through the wrist, and that affects your thumb, your index, and your middle finger. Most people are familiar with carpal tunnel surgery because that's very common if you have sort of repetitive stress jobs like being on a computer, or being at a cash register, anything like that, you can have carpal tunnel problems. So that surgery involves releasing the nerve, the medial nerve here at the carpal tunnel. Well, the ulnar nerve, which goes from here to here, its tunnel where it gets compressed is right here on the inside of your elbow. The ulnar nerve is also known as the funny bone. You know that feeling when you hit your elbow and all of a sudden you get that kind of twang? That is your ulnar nerve. So as I said, I experienced symptoms, for well over a year, but I finally got in to see a doctor, a hand specialist at the hospital here. And by the way, I am going through the NHS for this. The wait for surgery here is typically about 6 months, at least in my area, especially as it was not urgent. So I was expecting surgery somewhere around December, January, and I had travel plans in January. And to be honest, I was a little wary of the surgery. I thought, well, that I have other problems in my hands. My hands have a lot of problems. So I thought, I'll just put it off and I'll try to do these ulnar nerve release exercises that you see on YouTube, where you do this, what they call nerve flossing, where you kind of stretch the ulnar nerve out like this. And I also purchased a brace to keep my elbow extended while I was sleeping, because I sleep like this, as you probably do, or you may do as well. Anything that compresses your elbow, talking on the phone, folks, or working, anything can cause this ulnar nerve to be trapped in the cubital tunnel at your elbow. You can be in your 20s and have it. In fact, the lady that did my post-op said her daughter had just had it done. Other than sleeping like this, I haven't done anything extensively that I thought would lead to it, but it can also be genetic. So if you have symptoms like numbness, tingling, pain in any of your fingers, get it checked out, because the longer it goes on, the worse it gets. So let's fast forward to January. So I had a surgery date set up for January, and I kind of bailed out of it. And like I said, I thought I could try to fix it by doing those exercises, by wearing the brace. It didn't work. So after I lived with the symptoms for a few more months, they were getting worse, and I thought, right, I'd better go in and get that surgery. So I put myself back on the waiting list in April, and I ended up getting a date for surgery in mid-June, which wasn't too bad. Now, let me tell you what I decided to do. I decided to go with a local anesthetic instead of a general. Local anesthetic meant I could get the surgery done in a sort of on an outpatient basis at the hospital, rather than being checked in and having to stay overnight if I had had a general. In other words, if I'd been completely knocked out. And I think that moved me up the waiting list a little quicker. And as it turned out, I'm really glad I made that decision, because I was very clear-headed throughout the whole process, and it took no time at all. So the prep to the surgery, there really isn't any. I showed up for my appointment at noon, and he kind of explained the procedure, what they would be doing. They swabbed down my arm from the elbow down. I just wore a short sleeve dress, and I laid down on the table. They put this big paper sort of gown over me with a hole to put my arm through, and then it was kind of folded up here. So I really couldn't see what he was doing, but he was right there. He gave me a couple of injections for a nerve block in my elbow, which were quite painful, but he explained that I shouldn't really feel any pain. I should maybe feel some movement, but he was drilling and whatever he was scraping, whatever he was doing there, and I was, I was laying right there. But folks, it only took, I was out of there in less than an hour. So that was good. He explained to me that I wouldn't be able to drive for 2 weeks and I shouldn't get the incision wet for 2 weeks. I would be able to take the bandage, the main bandage or the big bandage off after 4 or 5 days. So what I was left with, they just put a square patch bandage over the incision, and that incision, of course, was sutured. And then they wrapped a big kind of gauze, heavyweight gauze bandage around my whole elbow area from my forearm up to the middle here, and taped that. And that was the part I had to keep on for 4 or 5 days. So I walked out of there. I was in Bath, so we went out for lunch, drove home. I was a little teary. I was a little kind of, weepy and moody after it, but I didn't have any knock-on effects from the anesthesia, and I didn't really have any pain. Their suggestion is just to take a couple of paracetamol every 4 hours as needed for pain. Paracetamol is kind of like Tylenol in the US. It's acetaminophen. So that's all they suggest. And like I said, other than it being tender, if I bumped it, it was kind of awkward to lean on or to sleep with, but I just slept with some pillows underneath it and I was fine. It was not that painful, which I'm happy to say. So the recovery timeline is after 4 or 5 days, you remove the big bandage. That's what this looks like. And then you are left with the smaller bandage that makes it easier to move your arm and kind of go about your day. You still can't get it wet, still can't dry. So fortunately, I had some very good help to take care of me. I would highly recommend that you do as well. Line up somebody to be there with you, not just to drive you home from the hospital, but to kind of help you out, getting in and out of your clothes or whatever you need, getting washed. Because especially if you're right-handed and this is done on your right hand, you will need some help. So don't try to do it on your own. I got the big bandage off after 4 or 5 days. After 2 weeks, I went into my local GP. They peeled off that, flat bandage and they trimmed the ends of the suture. And that was it. They kind of looked at it and said, yeah, it looks like it's healing okay. I didn't have any problems. If you do have any infection or any pain or real swelling or redness, do definitely get in touch with your GP because that could indicate an infection. But mine looked like it was healing well. So after 2 weeks, I was able to shower normally, wash, do all of my normal things. And even throughout my recovery, especially at the beginning, they said just kind of do your normal stuff, no weightlifting or anything like that, but kind of try to keep moving. And your body knows how to heal you. So do that and you will help it along. So after 2 weeks, like I said, I got the sutures off, got the bandage off, and then it was just up to me to heal. I had my 6-week follow-up about 2 weeks ago, 2 or 3 weeks ago, and I talked to the surgeon assistant and he kind of explained to me, what to expect going forward. Here's the big gotcha. So my symptoms were, I had a lot of numbness. If I would go into the movie theater and sit and watch a movie, it wouldn't be uncommon for my whole left side of my hand to go completely numb. Or if I slept in the wrong position, it could go completely numb. I have very intense pain in my pinky finger, which may not sound like much. It's a small finger, but man, it could hurt. It's almost like somebody taking a pair of pliers and squeezing my finger with it. And I still have symptoms. Now, he explained to me when I was getting the surgery, when he was kind of going through what to expect, that everybody's recovery is different. Some people get immediate relief from their symptoms after surgery. Other people, it takes longer. Well, I guess I'm one of those that's going to take longer. I think I left it too long. And I'm glad I got the surgery because this way I feel like it stopped the nerve from continuing to deteriorate. As long as that nerve is compressed in that cubital tunnel, it's not going to bounce back. I don't care how many YouTube exercises you do or what little props you use. It's not going to bounce back on its own. So if you have those symptoms, get it checked out. I'm glad I did the surgery, even though it's kind of frustrating that I still have some symptoms. They are getting a little better. They are more intermittent now than they used to be. So I'm very hopeful that they will, my fingers will fully recover and I can not be in pain anymore. Isn't that's the whole point, right? So anyway, I hope that was helpful. If you have hands and you have those kind of symptoms, maybe get them checked out. Don't leave it as long as I did. I'm a real procrastinator when it comes to going to the doctor, so don't do what I did. Go get it checked out, get that nerve conduction test done. This is what my scar looks like. This is, yeah, that's a little over 2 months. So it wasn't so bad. And so if you have those kind of symptoms, get them checked out. Hope that was helpful. Got any questions? Put them below. And thank you so much for watching. I will see you again very soon.